Hello, it's Anthony Chadwick for the Webinar Vet, welcoming you to our weekly question and answers. We're very fortunate this week to have Dr. Eliane Marti, who's going to be speaking to us from the University of Bern, where she researches into equine culicoides hypersensitivity, obviously known as sweet itch by many of us, and has also dealt with equine asthma as well. So I hope those of you have had a chance to look at the lectures. Dr. Marti spoke about the immunopathogenesis and immunotherapy of culicoides hypersensitivity, and then also looking at the potential for future development in the diagnosis and treatment. So it's lovely to have you on the call, Eliane, and such a huge problem and such a welfare problem in horses. What are your thoughts on how we're doing globally, or at least in Europe, treating sweet itch? Is it still a massive problem?
I think the treatment is still not good enough. I think the most important is still to protect the horses from the insects, to have an elimination of the allergens, and I think this is the part that is still working best when it's possible, either to use these sweet itch blankets. And I think even if the owners don't like to use them, but the horses, once they have seen that they are protected from the bite, they really like to have them on. But of course, it's not always possible if your horse is all the time in the field. It's more difficult, it takes more time. And I also think that management just of having the horses inside when at dawn or at dusk, or using some repellents that work, I think this is at the moment still the best treatment option. And of course, steroids also work, but you don't really want to have your horse all the time on steroids. So I think there is still need for improvement of treatment.
And I suppose with that, there will be a tendency for us to be thinking about, treatment as in clinical treatment, and maybe sometimes we're not as strong at the protective element of talking about husbandry and management. Would that be a fair comment in your experience as well?
The treatments that are presently offered, that they don't work, that was your...
No, more saying, do you think as vets we can be more into the clinical treatment, but not think so much about the protective measures, like having a blanket on the horse, keeping it inside during dawn, during dusk, and so on? Is that something that you think we do enough of, or do you think we sometimes, as clinicians, we're thinking more about giving it, an injection or an immunotherapy rather than some of the basic stuff that will help as well?
Yes, I think that the most important is to have the protection of insects. But one most important point also is that if you already have an ongoing strong sweet itch, so with this skin inflammation, I think you need to first use maybe some steroids just to cut this vicious circle, because if you have the inflammation and the horse is scratching because of that, so even if you put the blanket, it may not be enough, it will probably not work. So you first have to get rid of the inflammation, protect the horse from insects, and then the next spring, if you start to put the blanket on as soon as the horse shows clinical signs, then you can actually have very good results. But once you have a strong inflammation, it's usually not enough just to have just a blanket.
Yeah, of course. I'm conscious there's quite a few people on the webinar tonight and also on Facebook. Obviously this is a question and answer. If you have a question, it would be really great for you to share that in the chat box. You'll probably see that at the bottom of your screen. Click on the chat and then just put your question in, and obviously Eliane will do her best to answer it. Similarly, I have got Facebook open, so if you want to leave a comment in there or a question, do put it in there, and I will make sure that Eliane gets asked about it as well. Um, Perhaps you'd like to talk a little bit, Eliane, about the use of immunotherapy in horses and what you think a good success rate looks like. What percentage of horses do you expect to respond to immunotherapy?
That's a difficult question because for cholicoides hypersensitivity, I think that the placebo-controlled studies could not show any difference with the placebo. And this is probably because the wrong allergens are used, because these whole body extracts are used. And we also don't know what kind of cholicoides species are usually included in these extracts.
Yes.
They may be laboratory-bred species who are not present in the environment of the horse, and this probably also plays a role. And yeah, so that's regarding insect bite cholicoides hypersensitivity. Now with other allergens that are maybe a little bit more pure, but then this is of course not cholicoides hypersensitivity, the success may be better, but I don't really have experience with it. But of course, we also know from human patients that usually you have an improvement of the clinical signs, but that it's very rare that the clinical signs disappear completely. And what we also know from human studies is that really it takes years until the clinical signs decrease. So in the last European Congress of human allergologists, they reported that it actually takes 3 years until you really see an improvement.
Gosh,
so I think
a long time.
We have also to keep this in mind, that it's not, you may see some effect quite briefly after the treatment, but until you have a sustainable effect, it takes time.
It's not an overnight thing.
No.
Just while obviously people are on, perhaps you can just let us know where you're listening in from. So again, using the chat box, do click on the chat box and just tell us where you're listening in from. That would be interesting to know. So Eliane, what are your thoughts on where will treatment go in the next 5 to 10 years? What is the new stuff that's coming up that will make treatment of hypersensitivity generally, but also cholicoides particularly, more successful in horses?
I think that the treatment with the immunization with equine IL-5 could be something really useful for some cases of cholicoides hypersensitivity, where you really have this increase in eosinophils, but also for other diseases such as equine recurrent urticaria, where we often find massive numbers of eosinophils in the lesions. But of course, the big question is if this product will make it to the market, if companies will be willing to invest in this product. I think at the moment this is the big issue. But I think that.
Sorry, go on, Eliane.
Yeah, I think that would be an alternative to corticosteroids that could certainly improve clinical signs in horses that have hypereosinophilic disorders.
And it's quite a refined, it's much more specific. The steroid answer is always a bit more blunderbuss approach, isn't it? It affects so many different systems, whereas
yes.
If we
of course, in cholicoides hypersensitivity, you have also a lot of other allergy mediators that will contribute to the clinical signs. But if you do not want to use always corticosteroids and that you don't have good enough options to reduce the exposure to cholicoides, and even if in these horses it can help. I think what I have seen, that some horses really improve. They are not without signs, but there is an improvement.
That's fantastic, Eliane. It's great to see Joy's listening in from Raleigh in North Carolina, and we've got Leslie in Auckland and Sylvia also in New Zealand as well. So Sylvia and Leslie, well done. That is, I think, 5 o'clock in the morning. So that is a really early start. So well done for getting up so early. Eliane, is there any are there any studies being done using the French topical steroid product Cortevance in horses? Is that a potential treatment option, in that it is, you know, it's active within the skin but isn't having as many systemic effects, which obviously we worry about in horses?
Yeah, I don't really have experience with it, but I think that it can be used, and you know, if the lesions are really local, it will also help.
Yeah.
But of course, you have to apply it regularly, and you have to.
Yeah. I don't know if there's anybody in the audience that's using Cortevance. So again, do feel free to let us know if you are and what your thoughts are with it, or if indeed you've got any questions. Obviously going slightly off piste as well, but you know, you've done a little bit of work with Petra Rocha looking at IgE serum levels in atopic dogs. We often think of horses being more akin to cats. I mean, what are the different responses that you're seeing in horses with the IgE levels? I mean, is that an accurate way of measuring the potential allergic?
Well, now that we have these recombinant allergens and these good allergens, where we have so many horses that react positive, I mean, we have really the vast majority of the horses with cholicoides hypersensitivity that are positive with these allergens. And this is a big difference to the whole body extracts, where, of course, we had some background, some false positives, and also, but also it's by far not all horses that with cholicoides hypersensitivity that's also positive with these cholicoides whole body extracts.
It obviously is very much a sort of type 1 hypersensitivity reaction, so presumably you're seeing the wheels coming up very quickly, but do you also see delayed reactions on skin tests with cholicoides?
Yes. We have, I observe that we have different kind of horses. We have horses that have an early or a little bit delayed reaction after, I mean, it starts like at 30 minutes, and then they react after 4 hours, and then it's more or less gone. But then we have horses that after 24 hours that start to make a really very strong reaction. But it's not all of them, but a part of them. And so I assume that we have IgE-mediated reactions, and maybe in some horses we have additionally something else. But
and is that sort of genetic? Do you see, you know, different breeds of horse having different responses, or is it much more generalized than that?
So we don't really, except for the Icelandic horses where we have this environmental effect, but otherwise I would see that we can see cholicoides hypersensitivity in all breeds of horses. Of course, it's less a problem in a sport horse or in a race horse, because they spend a lot of time in the stable, so they are not so much exposed to the insects. But we can see cholicoides hypersensitivity in all breeds. But what we saw is that we have like a family predisposition. So we have some families where cholicoides hypersensitivity occurs more often. And sometimes you have parents that do not show clinical signs of cholicoides hypersensitivity, but then they have quite a lot of offspring that have it. It went up to 1/3 of the offspring in one warm blood family. And interestingly, when they changed the stallion, they had a few mares that were related, and they were always breeding to the same stallion. And when they changed the stallion, the problem disappeared. So there is a genetic factor, but it's very complex. And I mean, some genes or genetic markers have been identified, but it cannot really be used neither for breeding nor for predicting which horse will get the disease.
And I suppose the unfortunate thing is if you keep a horse in the box all the time, as you said, with race horses, then instead of getting colicoides, they just get equine asthma instead, do they?
Yes, this is correct.
Between the devil and the deep blue sea, you have to decide which one you want. Karen has a question. As much advice on managing recurrent urticaria as possible would be welcome as a practitioner, please. So what's the best way of sort of dealing with a recurrent urticarial problem, Eliane, in your experience?
Urticaria?
Yes, urticaria, yeah.
Oh, that's a difficult question.
We're not giving you an easy ride. We're making
no,
it.
No. Well, for me, of course, you have to know if it's recurrent urticaria or if it's just happening once. But if it's recurrent urticaria, if it's possible, it may be worth to change the environment of the horse. Ideally, just change the stable for a while to see if the symptoms disappear. Then what we sometimes see is we have urticarious horses that react to allergens in basophil activation tests, and some react really strongly to many different allergens. So one problem seemed to be mites, different mite extract. And we also have single horses that react to pollens. And I think it would be interesting, at least with the pollens, to see if the positivity that we see in the test, if it really relates to the to the season of the clinical signs when the pollens are around or in the environment. And in these cases, it might be interesting to try an allergen immunotherapy.
Which of the allergens are they more grass or are they more weeds or
in Switzerland? Yes, we have horses that react with grass allergens, but it's few horses, I must say. The majority, they will react to mites, or some will also react to insects, but rather to black flies than to culicoides.
And is the black fly sometimes more of an irritation than a hypersensitivity, or is it always a hypersensitivity?
Yes, it can of course be an irritation. And then we also have cross-reactive allergens between black flies and culicoides. This could be shown for one allergen that was produced as a recombinant protein. So it's an antigen 5 protein, and we could really demonstrate that it's a cross-reactive allergen. So a horse that is allergic to culicoides, to this antigen 5 allergen from culicoides, will also be positive to black flies. So I think in horses with culicoides hypersensitivity, we often also see that they react to black flies, but actually it may be due to cross-reactivity.
That's great. How do you think we can improve on our diagnosis of the disease? What are the new developments coming up that may help us with diagnosis as well?
At the moment, I think that the use of these recombinant culicoides could really massively improve the in vitro diagnosis. Yeah. I think we still need to keep in mind that if you measure IgE antibodies in the serum, it's not a proof that your horse is allergic. I mean, it may just be sensitized. But we have a vast majority of the horses with culicoides hypersensitivity that are positive, and only few controls that are negative. But of course, what we did so far was it was research, and this all needs to be validated then for diagnostic settings. But I think that there would be room for much improvement with these allergens now.
Leslie is asking, which specific mites are you testing for?
We are testing for a whole panel. So we are testing for Glucophagus, Lepidoglyphus, Turophagus, then Farine and Pteronissimus. Horses with urticaria are, I should say, more frequently positive with Turophagus or Glucophagus. But it depends, or they are positive with different of them.
And I suppose, again, you know, the stable environment can be rather dusty. We can obviously work on dust levels.
And of course, we have not, it has not been proven, but we also thought that maybe it seems that blankets can be a problem. You know, it may be worth washing the blanket. And also in the food, in these, sometimes there are also mites.
Yes.
Mite contamination, and this may contribute.
Do you see a problem with molds at all? Again, if things aren't kept very clean and so on?
I don't know. In the test, we have hardly ever positive horses, but I don't know if we just don't have the correct molds in that we test, or if they are really not a problem.
Okay, that's great. I've got another question from Frederick, who's saying, regarding food hypersensitivity or cutaneous adverse food reaction, I would like to have your opinion on the prevalence of this type of hypersensitivity in horses, and your opinion on if it's an atopic-like disease associated with pollens found in grasses and hay, or if it's a real food allergy. Do you have any experience? I know we're taking you a little bit out of your research area. Any thoughts?
No, I don't really have experience with food allergy or uptake of allergens by ingestion of allergens.
Eliane, I wonder if you could tell us your experience then with obviously using the vaccines, the hypersensitivity vaccines, to desensitize horses. Do you follow a very strict regime on the dosage regime, or do you feel, as I used to find in dogs, that there was quite a lot of art to using immunotherapy and in also getting a sense of, was the dog in that case responding for the whole 4 weeks? Did we need to bring the treatment down to more frequent? What are your thoughts around frequency of immunotherapy treatment?
This is also a very good question, because we have actually not really done any allergen immunotherapy trials so far. We are going to start some, but we don't have any experience with the need of the frequency that is used. We did with our collaborators in Iceland, in the development of a preventive immunotherapy. We did 3 injections and we see a nice IgG response, but we don't know if this is enough actually in a horse that already has an allergic condition. It may be that we actually need more injections, more frequent, not more frequent, but more injections until we get a regulatory immune response, or until we have a decrease of the clinical signs. But this will need to be tested in the future. I mean, there were some reports in human allergy that 3 injections in the lymph node were sufficient to reduce the clinical signs. But I heard from some colleagues that just did some trials on private horses, and they did immunotherapy with, they continued. They started in the lymph node, and then they started with subcutaneous injections. So I think we have to see how the response is and also look at immunological parameters, and then we will know more. But at the moment, it's really difficult to say if few injections are sufficient.
Yeah. Okay. Thank you, Eliane. We've got more comments, I think, from Karen, who had asked the question about the recurrent urticaria, and she said she'd done intradermal skin testing, and the horse was allergic to multiple grass tree pollens. She was starting immunotherapy, but that's difficult in a competition horse, and also gets very irritated by fly bites. I mean, those flies can give a nasty bite. I've been bitten by a horse fly once, and you can almost feel it, never mind anything else, can't you? So as I say, there's the irritation must be really hard for horses as well.
Yes.
Any more questions? Anybody got anything? Let's just see if there's anything on Facebook. We've got about 2 or 3 minutes left, so this is your chance if you want to ask a question. Let me see, is there anything there? No, I can't see any questions on Facebook. Let me just go down and see if any more come up. 1 second. And Eliane, thankfully at this time of year, with snow on the ground in Switzerland, presumably you have a quiet winter without too many sort of cases to see and research.
No, now we have time to
do the
produce recombinant allergens and work in the lab.
Let me just see if I can pull this up. It's proving to be a bit temperamental.
And maybe I should say that if people have horses with recurrent urticaria and that they are interested to send us serum samples of clinically well-documented cases, or if you already know from skin tests to which allergens the horses have been reactive, we have this chip array, and if it would be very interesting to have a panel of sera that we can test, and it would of course be very useful then to also have serum from a control horse from the same, living in the same environment, to see if we can start to know a little bit more on the allergens that are important for horses with urticaria. So if you have such cases, then maybe please contact me, send me an email.
Eliane, do you want to perhaps, I don't know if the chat box is open to you, but perhaps if you tell us what the email address is, Helen, who's also on, can pop it in the chat box for people to take if they require.
Yes, I will write the email.
There we go. So it's eliane.marti@vetsuisse.unib.ch. So do take that down if any of you are interested in getting in contact with Eliane about specific cases that are well documented cases of allergy in horses, and Eliane may be able to help you with looking at those. I don't think there's any more questions, Eliane. Just to say, I really enjoyed coming on the session today and being able to quiz you about immunotherapy and just the progress that we're making in what is a really difficult and rather uncomfortable disease for horses. So thank you for the work you're doing to try and solve some of this conundrum.
Yes, thank you very much for the webinar, and it was nice talking to you.
Great.
Getting some questions.
Hopefully.
That see what is bothering the people and the practitioners. Yeah,
no, that's great. Thank you so much, and thank you everyone for listening. And do let your friends who have come onto the conference know about the question and answer session. It will be available on the site. It's also available on Facebook, so you can always watch it again, or indeed tell your friends who have also registered for the conference. So thanks everyone for coming on.
Thank you very much.
Again, Eliane, thank you very much.
Bye.
Take care. Bye-bye.
Bye-bye.